Hi guys, it's Nurse Cam. I thought I would just come and do a video. It's been a while since I've done a video. Um, just school is getting really busy and I needed a break from studying, so I thought I would do a video. Plus helping some of my friends, and actually right now nobody needs any assistance, or well, they do, but they said later on in the week. So I'm trying to finish up some of my homework, which I'm doing. We're starting our research project because we graduate next year, and we have to turn in a graduate project. And I am so tired of reading these research papers. Everything's just starting to look the same. So I thought I would come on here and talk to you, and it was perfect because some of my fellow YouTubers that are also in NP school are going through the same thing, and research projects they're not as interesting as learning the nitty and the gritty and the stuff that we're really interested in, and that's actual practice. My practice classes are actually going great, and I was going to do a video going into my clinical, but it was just so busy that day, and I get to do a lot of things, and so it's really fun. And by the time you get through the actual clinical, it's already time to go home. But maybe one of these days I'll be able to video going in or something like that, or do a video of kind of not divulging any information about actual patients, but the stuff that I do while I'm at clinical. Somebody was talking about remembering the things, or having a script per se, or so that you don't forget anything during clinical. One of our clinical advisors recommended this book. It's actually like a notebook, but it's called Perfect H&P. See, Perfect H&P. It was like that when I got it, so in case you get one like that, or you don't, maybe yours will look nicer. It was all wrapped in plastic, but I guess it was too hot for the presses or something. Don't know. But anyway, I'll show you. The good thing about this is that I want to make sure I'm not on an actual patient. It gives you a spot to write your chief complaint and a summary of the patient and all the stuff. It helps you remember all the little things that you have to remember when asking or talking to a patient. It also has all the ROS, review of systems, and then the next page will have your actual physical exam, and then also on the bottom there you can put what your findings were, where labs were, just stuff like that. And the good thing about it is it doesn't get lost, it doesn't get messed up, because you keep it. So there goes one patient today I saw, and then here goes another patient, and so on and so on. So in case you write a note and then maybe you have to do some fixing to the note or something, you don't have to go crazy looking for it. You'll already know where it is, and you can put whatever notes you need to, so that you know. So when you turn it into your school server to turn in your clinical paperwork, it's all together. So this is one of the best things. Of course, it's not all inclusive, and there might be other things. And if you guys have something else that you guys use that y'all find is useful during clinicals, for your family nurse practitioner or acute nurse practitioner or whatever nurse practitioner program you're going to, I would appreciate that also. I'm always buying new books. I can never have enough books. So, but anything that I find that I think will be useful for anybody else, I'll pass on. And this has been helpful for me. And I also added things to it as I go along. Things that are important to me that I like to chart. But the more you do it, the better you get. So no fear. As you guys go into clinicals, they don't expect us to be, perfect. We're expecting to see growth. And even as your job as a RN, your fellow peers and your doctors and everybody that you work with, they're going to see your growth. And it was awesome this week that or not this week, it's been a couple weeks, but I guess it felt like this week because I haven't talked to you guys in a while. But a couple weeks ago, I was asking questions about one of the patients in our panel, and we're just having some difficulty in figuring out kind of what's going on with him. And I asked the doctor if we could order this or that because of this and that. And she was like, I can see your growth, and that's a good idea, and we should do that. And we ordered it, but it's great to kind of not only see your growth within yourself, but somebody else see your growth too. So I look forward to having more moments like that. And I hope you guys start sharing that stuff also, because it's motivating. Sometimes our assignments are not the funnest. I like research. I just don't like writing about research. All the nitty itty bitty parts of it. I don't like, but there's some cool stuff that I found while I was doing my research, because I guess when you're having to do a project and you're doing on something that you're interested in, more than likely you're going to find peer reviews maybe from your hospital. And not only did I find a peer review from not necessarily my hospital, but my system. And so I found 2 articles that are discussing the same thing that I want to do research on, which is crazy. So that means that it's probably something system-wide that would benefit some research and maybe some quality improvement and some change, which is awesome. But I also found out, from researching, that where I used to work had also done some studies in that. I didn't work in the departments that were doing the studies, but it's just interesting to see your idea on paper, that somebody else's thought of and that has done some research, and to actually see, that there might be, some room for change and things like that. So what else did I want? I wanted to show you the other books that I got. Some people were saying like they wanted to be better with their assessments and things like that. So I found that this one, for this series, because there's more than just family medicine. Look up case files. They have tons of them. I'm going to try to find pediatric and mother baby, because next semester that's the one that we're doing, or that's the clinical that I'm doing. But this semester and last semester, it was more family practice, and my last semester will be family practice. So yeah, I just love them. And then over the summer, I'm not going to school, so my plan is to continue to read these and get better with the understanding. That's the good thing about this book. So, for example, it talks about upper respiratory infections, and then it gives you a case. So, discuss a case about a person. And so, of course, we know what the likely diagnosis is, but then it also tells you what medicines that you would be getting. What are some other things that you might consider? So some differential diagnosis and other considerations that we should be thinking. And it just helps you think through those parts, if that makes any sense. Because we all know what acute bronchitis is. We all know what COPD is. We all know, what GERD is and all that other stuff. But how do we think past, okay, this is the illness and this is the illness. Maybe they have a combination of the illnesses. So it just kind of takes you through there, the different treatments and things like that. Very useful even while you're in school, because you can take that little section, think of how they're helping you think. And I found that it's helped me with my test. So my first test, I did okay. I just say okay because, I'm still a typical nursing student. We want all A's, and that's all we want. We just don't want to miss anything. So the first test, I think I missed 4. I missed 4 questions, which just, it didn't make me feel good, and I actually missed them because I was like, I really don't understand, but some of it wasn't my fault. I know. Some of them were my fault because the test is online and they were pictures, but my pictures didn't show up. But the description was there. But I am very, like, I need to see things. So I believe that if I seen it, then I probably would have answered a little bit differently, or would have helped me narrow down what I was thinking faster. But anyways, it is what it is, and I just said that I was going to do better on the next test. So the next test, I changed a little bit the way that I studied. Not so much in how long I studied, because I studied forever, but I just changed how I studied. Whereas I spent so much time trying to make note cards, and we have so much reading, it's kind of impossible to make all the note cards that I want, or all the notes that I want as far as papers. So what I did this time is I wrote my notes within my book. And I do have a little bit of a picture, like a photographic kind of memory. So I'll know if I wrote it somewhere, my mind will be able to take me to the, the page or whatever. So if I need like a refresher, because we don't have that long to take our test. We only have 30 minutes or less to take the test. So you only get 2 minutes per question. So it's not like you could sit here and figure out all the answers from the test. So we are allowed to use our textbook to go back to like clinical guidelines and things like that. So being able to write in my book, I noticed that I'm able to flip to a page or whatever a lot faster. So maybe that might be a suggestion for somebody that's having a lot of trouble getting their notes written and thorough enough to be able to use for your test or studying. So I noticed that writing in the book made me have to look back less often. So I don't know, maybe help you guys. I can show you real quick. So this is an example, and if you can tell, there's no highlighting marks. There's just underlining and notes to the side. So that's what I did, and on the next test, I got 100, and on the next test, I missed 1. And I think that's just because my mind, I memorized it. I memorized the information, I guess, solidly, no gray. And so I didn't even go look it up. So the question was something like, in a patient, or the definition of, what was it? Well, it was talking about restrictive or reversible and irreversible diseases as far as pulmonary. So we know we have COPD. And if you have COPD, that's a branch of emphysema and also chronic bronchitis. Well, along with that, and there's asthma. So asthma is reversible. That's what makes it different from chronic bronchitis and emphysema. And so that's just how I memorized it. And actually the definition for COPD is like progressively and like hard to reverse, not technically irreversible, even though the text a lot in a paragraph says irreversible. That's the damage is irreversible for emphysema and chronic bronchitis. But with asthma, you're able to treat the symptoms, and they can kind of go back to exactly how a normal person is with regular treatments. But anywho, I just memorized it as black and white. Chronic bronchitis, emphysema, COPD, all those 3 things, they're irreversible. And asthma, reversible. So when I saw the question, I was just like, irreversible, asthma, done. Next question. So I missed that question. So anywho, I know how I missed it, and I understand it. So I like that feeling of being able to understand where I missed, instead of getting those kind of questions where you're like, man, I didn't even know what to pick. I just guessed. So then I also wanted to show you guys this book. I love this book. I use this book all the time. I will use it for my certification, and that's the reason why I got the book. A lot of people recommended this book. It's Leik, L-E-I-K, and she does a really good job with summarizing everything that you need to know for systems and giving you little hints of things that you need to remember for boards. And then the only thing I don't like about the book is that the questions are all in the back and they're all mixed together. So if you're trying to do some questions to review before you take a test on a subject, you had to look through all the questions. I had to do it every single time. But I like the questions. They make me think, and they make me know where I need, refreshing or something like that. And so, yeah. Anywho, great book. You should get it. All right. Now, this book I just got, and I love it. I have too many books, y'all. But anyways, and I don't know why I want to find time to go. But anyways, this is Family Nurse Practitioner book, and the author, her last name is, I can't even say that, but it's Zerwekh. And the good thing about this book is it is separated into systems, but it doesn't do a review of anything. It's just questions. That's it. Just questions. But the rationales are what I love. It is very detailed and also explains why the other answers are incorrect. So you know how sometimes it just tells you, you have review books and they just tell you what is right, the right answer, but they don't tell you why the other answers are wrong or why they were trying to trick you with those. This book helps me with that. And I think that's another reason why I did so good on my NCLEX, is because I used a lot of review books to study from. And even when I got a question right, I always like to, even like I knew the answer, but I didn't know why they were trying to get me to pick all the other answers. And I find it helpful on reviewing the wrong answers also, so that I don't make that mistake. Okay? But what else can I show you guys? So those are the two books I wanted to show you. I wanted to show you my HMP book. Did I show you guys my clinical jacket? So this is my clinical jacket. It goes all the way down. Let me see. I like it a lot. On the right side, there's two pockets. And one pocket is perfect for it's like an inner pocket, and it holds your cell phone perfect, like it won't move. And in the other pocket, you can hold other things. This pocket only has one pocket, and this jacket is stain resistant, water resistant, everything. I don't remember who made this jacket. Let me look real quick. It's a Vera G. That's the type of jacket, and then that's the maker of it. And I got it at, a little nursing boutique, but I'm sure you could find it everywhere. So I love this jacket. I love that it doesn't really have like a collar, but it has this little part right here, and it keeps me warm. Actually, I was wearing it because I wanted to show you guys, but I'm going to put it away. I'm going to put my sweater on. And why am I dressed up? We are going to a concert, and I probably shouldn't be going to a concert because I got to finish my research paper, but good thing is I work for the VA, and we have holidays off. So tomorrow, for my holiday, I'm going to be doing homework. I was going to do homework anyways, not like I wasn't, but anywho. So I hope all you guys are doing great. I hope you guys keep us all updated on how your classes are going. I got a new lipstick. You guys like it? I hope you like it. That, and it doesn't come off. It's one of those new stains. One of my friends were selling it in New York. It's called Lip Sense. And the color, forgot the color. Oh, it's Napa. The color's Napa. But anywho, I don't wear that lipsticks and makeup that often. But I might have to start wearing this one. And it feels really good. Makes my lips feel soft. But anywho, I hope you guys enjoyed this video. I hope your studies are going well. Keep everybody encouraged. You guys keep doing videos. Let us know how those projects and stuff are going. I need to write down all the blogs that I follow so that I can let you guys all know who I listen to, and you guys can watch them too and be supported by their, you know, their journey also. I wish everybody luck, and I hope everybody has a good week and finishes this semester off strong. I wish I didn't have to do this research paper because it is no fun. Oh, I'm doing my research paper on, or my project is going to be on diabetes case management and the effects on patients. And if we did a more, or how our influence as nurses with educating our patients, how it affects their own self-maintenance of their diabetes, something like that. But anywho, I hope you guys are enjoying your weekend and you had a good holiday. This year is going by fast. We're always at the end. We're already at the end of February. Well, I guess it's kind of in the middle, but February is only 28 days. And we're going to be on the 20th tomorrow. But anywho, I'm going to go see R. Kelly, the concert, and he's playing out here. I'm going to write my paper until my husband came on, because you have to give up some things. So I've missed a lot of things because of studying. So my family is at a birthday party for one of our cousins. I've missed weddings, I've missed all kinds of things, but everybody knows what I'm doing, and they know that I would come if it's something that I can do, or if I have enough time, or if I can fit it. You know, I feel bad picking and choosing. So for a while, I don't want to go to anything because I don't want to feel like people think I'm like picking and choosing on whose stuff is important to go to and whose stuff is not, because we live near my husband's family and he has like 100 first cousins, like legit. Like there's 100 cousins of his around his age. There's always something. There's always a wedding, there's always a graduation, there's always a birthday, there's always something that they're celebrating every single weekend, and at least a couple times during the week. All the time. And so, and it's not like I can say anything. I mean, we have 7 kids, so we always have something. My daughters got into college. I didn't even mention that. That happened about 2 weeks ago too. So my 18-year-old just got accepted into a college, and my daughter that's a junior, she's also got some college offers. But I don't know if you guys are prior military, you guys know any things, but she got accepted to Annapolis for their summer program, and this is to see if they would like to be going to college at Annapolis. She's been dreaming of this, so it's so exciting. I don't have in my office at work, I have all their military pictures. And my daughter that's in the Navy, she also just finished a school. And so I'm proud of her for that. And my daughter that's in college in Missouri, that's on her junior year, she's transferring here. She wants to be closer to home. So she's transferring to a college that's in the city. So I'm just excited. I'm excited for everybody. Everybody has something that's so positive. So I'm so happy about all the positive stuff that's going on right now, when our world has so many negative things going on, but we all can hold up each other and keep each other going in positive ways. Make sure that you're passing that on to anybody that's, you know, around your circle. Make sure you encourage them, and because everybody needs encouragement, and you don't know that you might be that vessel, you might be that person, and I believe that that's important with everybody to help encourage growth. You know, I don't know, maybe it's the nurse in me, or the mom in me, or the military person in me. Military taught me to we're as strong as our weakest. So, you know, if somebody's weak, you make them strong, you know? Well, it was nice talking to you guys. I'm sorry that it took so long. I'm not gonna do a bunch of stuff to the video. I'm just gonna post it. I'm gonna try to post more videos. I don't know. Everybody just messages me, and then I wind up just calling them or directly emailing them, and then I don't know what to talk about. So I will try to share more stuff going on. It happens so quickly, and I don't really know what everybody kind of is. It's like, I guess I should just post it, everything, and that way I can look back at these videos and see, you know, the growth and where we all, or where I came from, and how different I am. So you guys keep pushing and keep driving. Go to Barnes and Noble and sit in the nursing section and pull those books off the shelf and look and see if they help you. And if you find something that helps you, post it in a video, and make sure that we can see it so we can go out and utilize those tools too. I think a lot of times there's things out there that we can use to help each other, and we just don't know, you know, what's out there. Stay encouraged in your classes. Don't worry if you do bad on a test. It's one test, and you can make it up with another one, okay? So go out there, do your best, and if you guys find out, or if you guys have questions about something particularly in clinical that you guys want me to inquire about, or you want to ask and see if I've, you know, been there, let me know. My clinicals, pretty much, I just schedule it with the provider, and I just show up in the morning, and I take a caseload, and I examine the patients, and then I'll come back and kind of report what I believe and what I believe our treatment should be. And if she says everything was cool, which is a lot of the times, it makes me feel great, I can just go back in the room and tell the patient, you know, what we discussed, and they can go schedule for their next appointment. And it's rewarding. Wait till you do clinicals. You're going to feel great. I feel great. I love my clinicals, and I do feel that I'm growing, and I don't feel like I know everything. And every time I go to clinical, it's a growing moment. I just feel like I learn so much every single time. Like every patient, I learn something. Everyone, I come away with something new. So even though you've treated diabetes and hypertension a million times, you've never treated that patient before. You know, they tried this medicine, it didn't work. They tried that, it didn't work. And because I work for the VA in primary care, we don't use a lot of the newer medications. We use a lot of the cost-effective medications. So yes, there might be this one medication that you could take that's very effective, that you could take once a week, but we still use like metformin. You know, not that metformin is the gold standard of treatment for diabetes, but as I say, as we continue to use that metformin, it's not working, blah, blah, blah. A lot of clinics can try something else, or we'll order different labs, and we tend to order, you know, basic. So going to clinical is helping me grow you know, as a person, as a provider, because I'm able to see what the outside private sector is doing for healthcare. So, anywho, it was nice talking to you guys, and I'm really going to end it this time. And I will try to do a new video soon. Miss you guys.